Chemotherapy is the use of whole body treatment, even if a cancer is not situated right throughout the whole body. And it's essentially the use in pancreatic cancer of powerful drugs that poison cancer as it grows.
Radiotherapy is using radiation. There's various forms of radiation, but the main one we use is a photon or an X-ray. And we focus that radiation beam to the area that we need to treat, and that radiation damages the cancer cells and hence kills cancer. You don't feel the radiation, there is no pain. The main difference between chemotherapy and radiation is the method of delivery. Both treatments are aimed at killing cancer cells. Chemotherapy tends to be a drug either delivered via tablet or infused into the bloodstream, whilst radiation or radiotherapy uses radiation to focus to the area that we require.
Perhaps one of the most important things to understand is that chemotherapy is a whole body treatment, and radiation, a bit like surgery, is a treatment that goes to one part of the body alone. And they're often used together to be complementary to get the best outcome for somebody. The common side effects of chemotherapy are losing hair, of disturbance of the gut, but perhaps most critically of weakening of the blood. And there are treatments for them, but there are still risks with the treatment.
The most common side effects for patients undergoing radiation treatment for pancreatic cancer often tends to be a degree of tiredness or fatigue or a lack of energy. But the biggest one that tends to affect patients the most is a lack of appetite, and they just don't feel hungry. Nausea and vomiting can be a possible side effect, as well as indigestion, reflux type symptoms, as well as diarrhea or abdominal cramping. And the last component is more the logistics of the radiation. It's a daily treatment for most patients, Monday through to Friday.
Side effects from chemotherapy to some extent are inevitable, but we can at least soften most of them. I mentioned that common side effects such as loss of hair and disordered function of someone's stomach and bowel and low blood counts are all very common. And we do have medication, or perhaps more correctly, procedures and treatments that can assist. As an example, it's possible for some chemotherapies to be given with a special cap that cools the skull and so stops chemotherapy affecting hair follicles and stops hair loss. We can also overcome some of the risks of a lowered blood system from chemotherapy by the use of modern developed supplements that are approved and are now considered standard of care to mitigate the risk of someone having an infection on chemotherapy. The fatigue is often the thing about chemotherapy that's the easiest thing to say but the hardest thing to properly describe. The way in which you plan your day and the way in which you plan your life and your lifestyle is important. It's critically important to put time aside for rest, but equally important to put time aside for basic exercise to overcome those sorts of side effects. It is still hard to completely stop the feeling of tiredness, but most of the tangible side effects that worry someone, we can soften.
The key message to patients would be to really have an open line of communication with your oncologist. Really let them know, even early on when it's just mild side effects, what you're experiencing.
The chemotherapy treatment for pancreatic cancer is, at its duration, largely directed by the stage of the cancer or how extensive it is. Chemotherapy will run for somewhere between 4 to 6 months, and then hopefully that is the completed course. On occasion, the chemotherapy is given before surgery for a couple of months and then perhaps after for a couple of months, but generally 4 to 6 months. In the setting that the cancer has become advanced and that chemotherapy is the mainstay of treatment, we don't really put a time frame on how long chemotherapy is given. We'd like to think that it can continue indefinitely if it continues to keep the cancer contained.
The duration of the radiotherapy treatment really depends on the reason and the indication for the radiation treatment. Often if we're treating either before surgery or as a definitive radical type treatment, it might range from 3 to 6 weeks. But if we're using the radiation to select out a specific symptomatic spot for patients who have more widespread disease, then it could range from just a single treatment up to usually around 2 or 3 weeks of treatment.
Chemotherapy is important, but it's not essential. And there are people who find it difficult to tolerate. That's a not uncommon problem that we face, and we deal with it with these different procedures. Often that means we're turning to different treatments in a salvage situation like radiation, special procedures that are conducted in hospitals that their jaundice may be corrected by procedures. And then of course there's surgery, which we think of as the most important treatment, but I would usually not regard that as an exclusion to chemotherapy. It's all part of a big package.